Pushpin position overview. Employment type. Permanent part-time. Location. Cooma. Position classification. Social worker level 1. Remuneration. $38.51 to $45.90 per hour. Hours per week.
29.
Requisition ID. REQ 639688. Applications close the 20th of February 2025. Interview details. Scheduled within 10 days of closing. Herb about the service. Join our team as a social worker, supporting our community through compassionate care. Are you dedicated to helping patients and their families navigate complex social and emotional challenges? At Southern NSW Local Health District, you play a crucial role in providing holistic support, addressing the social, emotional, and practical needs that impact patient health and recovery. You will work closely with medical teams to connect patients with resources and empower them during vulnerable times. Join us to help build stronger, healthier communities through social support and advocacy. Handshake support for employees. Our applicants for this position may qualify for the NSW Health Rural Health Workforce Incentive Scheme, RUSES, of working within SWSLHD and sustainable healthcare, together towards zero salary packaging options are health and well-being benefits including fitness passport and annual influenza vaccinations are a team that values your expertise, invests in your development and supports your lifestyle. Moving to the area, visit the Welcome Experience NSW Government. What you'll be doing. The allied health professional is an integral part of the multidisciplinary healthcare team, providing quality social work services to patients and clients of the SNSW Local Health District in order to meet their health and well-being needs. This means you are part of the MDT. You provide clinical social work services. You work within a health-based model. You contribute to holistic care planning. Graduation cap qualifications, selection criteria.
Key Cap 1.
Tertiary qualification as a social worker and eligibility for membership of the Australian Association of Social Workers, AASW. White right pointing backhand index, this means AASW eligibility is mandatory.
Key Cap 2.
Demonstrated effective written, verbal and interpersonal skills. White right pointing backhand index panel will assess documentation clarity, communication style, rapport building, MDT communication.
Key Cap 3.
Demonstrated ability to work as a member of a multidisciplinary team. White right pointing backhand index they expect. Collaboration with doctors, nurses, allied health, community services.
Key Cap 4.
Demonstrated ability to effectively prioritize and organize own work at caseload across a regional area. White right pointing backhand index, this is crucial in rural settings. Travel management. Triage. Risk prioritization. Time management.
Key Cap 5.
Demonstrated commitment to quality improvement and evidence-based practice relevant to clinical discipline. White right pointing backhand index they want. Use of structured assessments. Supervision engagement. Reflective practice. Practice improvement mindset.
Key Cap 6.
Current unrestricted driver's license and the ability to maintain. Ability and willingness to drive or travel as the role requires. This may involve driving long distances. White right pointing backhand index rural expectation. Independent practice. Outreach visits. Regional coverage. Globe with Asia Australia commitment to Aboriginal and Torres Strait Islander health. Southern NSW Local Health District is committed to closing the gap in health outcomes for Aboriginal and Torres Strait Islander peoples. As part of this commitment, the Stepping Up website has been developed to support Aboriginal and Torres Strait Islander job applicants through the NSW health recruitment process. Shield Category A position. This is a Category A position. Recommended applicants will be reviewed for compliance with NSW Health Policy Directive PD 2024-015, occupational assessment, screening and vaccination against specified infectious diseases for Category A positions prior to offer. All new employees must agree to comply with the requirements outlined in the policy. Baby-child safe standards. Southern NSW Local Health District is dedicated to fostering a child-safe environment that respects and upholds the rights of children and young people, aligned with NSW Health's commitment to implementing the child-safe standards. They are expected to prioritise the safety, welfare, and well-being of children and young people, actively working to protect them from harm and abuse. Scales equal opportunity and inclusion. The district is proud to be an equal opportunity employer. They encourage applications from Aboriginal and or Torres Strait Islander people, people with disability, LGBTQI+ people, people from diverse experiences and perspectives. Memo recruitment adjustments. If you require any accommodations or adjustments to the recruitment process, you can request support to ensure an equitable and barrier-free application process. Australian eligibility to work. To be eligible for permanent employment in this position, you must be an Australian citizen, a permanent resident of Australia, or a New Zealand citizen with the current New Zealand passport. Calendar additional information. Primary location, South Coast Organisation, SNLHD Director Operations 986883. Posting date, the 11th of February, 2026. What this role actually means practically. Ali, this is a heavy checkmark rural generalist hospital social work role. Heavy checkmark MDT based. Heavy checkmark travel and autonomy required. Heavy checkmark strong prioritization skills needed. Heavy checkmark likely mixed caseload, medical, mental health, discharge planning, crisis. If you want next, I can. Fire break down the likely interview questions for this rural level 1 role. Fire map your Vinnies Plus CMRC experience to this exact rural hospital context. Fire create 5 high-scoring star answers specifically for cooma. Fire prepare you for rural-specific panel traps. Tell me your next step, Ali. Excellent, Ali. Clapping hand sign. Now I will fully transcribe and structure the entire position description, PD 004970, Social Worker Level 1, cooma, from the attached PDF, without skipping content, and present it in your preferred format. Bold core job language. Italics explanation a meaning. Underline panel scoring keywords. Clear headings and structured breakdown. All references are drawn from the uploaded position description. Hospital position description. Social Worker, Level 1, cooma. PD 004970. Herb working in Southern NSW. People caring for people. Our staff work in collaboration with all team members to ensure the needs of patients and families are central to the decisions of the healthcare we provide. You are committing to demonstrate the core values and behaviours. collaboration, openness, respect, and empowerment, core. White right pointing backhand index. This is extremely important for interview language. Office building organization details. Organization, NSW Health Local Health District. Southern NSW Local Health District position classification. Social Worker Level 1, Social Worker Level 2 State Award. NSW Health Service Health Professionals, State, Award Category. Allied Health Social Worker Vaccination Category. Category ANZSCO Code 272511. Social Worker website www.snswlhd.health.nsw.gov.au. Bullseye primary purpose of the role. The allied health professional is an integral part of the multidisciplinary healthcare team, providing quality social work services to patients and clients of the SNSW Local Health District in order to meet their health and well-being needs. What this means practically: you are part of the MDT. You provide clinical social work services. You support health and well-being outcomes. You contribute to patient-centered care. Faced with medical mask respirator use, NSW health workers may be required to use a respirator as part of their appointment. If required, workers will be instructed in safe use, including donning, doffing, and fit checking. Staff may complete fit testing. When required to use a respirator, no facial hair must be present. Processes exist for religious or health exemptions. White right pointing backhand index. This reflects infection control and WHS compliance. Graduation cap essential criteria. Tertiary qualification as a social worker and eligibility for membership of the Australian Association of Social Workers, AASW. This is mandatory. Pushpin key accountabilities. Key cap 1 professional accountability. Be accountable for the provision of a professional social work service to promote the health and well-being of people in Southern NSW Local Health District. White right pointing backhand index. This means ethical practice, safe clinical judgment, independent responsibility. Key cap 2 clinical supervision. Actively participate in clinical supervision and complete activities associated with clinical supervision as negotiated with supervisor in order to develop and maintain professional skills and deliver high-quality care. White right pointing backhand index panel expectation. Reflective practice. Openness to feedback. Skill development. Key cap 3 quality improvement and education. Participate in quality improvement activities and workplace education to contribute to improved care for patients to clients and their families. White right pointing backhand index. They expect engagement in service development, learning culture, evidence-based mindset. Key cap 4 performance development. Participate in performance development processes to contribute to own professional growth and service outcomes. White right pointing backhand index. You must accept review, engage in appraisal, set development goals. Key cap 5 cultural competence. Develop and demonstrate cultural competence and a commitment to improve the health outcomes of Aboriginal people. White right pointing backhand index. Extremely important in rural NSW. They will assess cultural safety, awareness of closing the gap, respectful engagement. Key cap 6 transition to level 2. On transition to level 2, work independently. Provide high-quality clinical care. Provide supervision to level 1 staff. Assist in development of procedures and guidelines. Promote standardized evidence-based practice. White right pointing backhand index, they are assessing leadership potential. Warning sign #key challenges. Contribute, in an environment of constant change, to delivering high-quality clinical services and a positive patient-to-client experience. This means adaptability, resilience, managing change, maintaining quality under pressure, handshake key relationships, line manager, clinical supervisor, escalate issues, keep informed, advise and receive instructions, multidisciplinary work team, share information and collaborate to achieve team outcomes, patients are clients and families, understand needs and deliver high-quality patient-centered care, other allied health providers, communicate professionally in delivery of care. White right pointing backhand index, this is MDT heavy role. Clipboard selection criteria, tertiary qualification and AASW eligibility, effective written, verbal and interpersonal skills, ability to work within MDT, ability to prioritize and organize caseload across regional area, commitment to quality improvement and evidence-based practice, current unrestricted driver's license and willingness to travel, shield other requirements. Southern NSW Local Health District is committed to person-centered environment, safety and quality, compliance with legislation, awards, policies, NSW Health Code of Conduct, modeling core values, participating in performance review, work health and safety compliance. All employees must take reasonable care for self and others, follow WHS policies, maintain safe workplace conduct. What this role really is, in practical terms. Ali, this is a heavy checkmark rural hospital-based social work role, heavy checkmark MDT, integrated heavy checkmark high autonomy, expected heavy checkmark strong prioritization, required heavy checkmark cultural safety emphasis, heavy checkmark supervision, and professional growth focused heavy checkmark WHS and infection control compliance. If you want next, I can. Fire compare this cooma role with Bankstown ACC AOT. Fire prepare rural hospital specific star answers. Fire identify likely interview questions from this PD. Fire map your Vinnies Plus CMRC experience directly to each criterion. Tell me your next move. Ali.
From Joe
Ali, clapping hand sign, excellent. Now we move into strategic interview mode. Below is a complete preparation pack for the cooma Level 1 Rural Hospital Social Worker role, in your exact style. Bold core job language. Italics explanation. Underlined scoring keywords. Clear structured headings. Hospital Part 1, Comparison. Cooma Rural Hospital versus Bankstown ACC AOT. Herb Keycap 1 Service Model. Cooma Rural Generalist Hospital Role. Inpatient plus outpatient mix. Medical plus surgical plus mental health presentations. Discharge planning focus. Crisis plus adjustment support. Broad caseload. White right pointing backhand index, you are a generalist clinician. Bankstown ACC AOT, community mental health. Severe and persistent mental illness. Assertive outreach. Relapse prevention. Risk heavy. Mental Health Act application. White right pointing backhand index, you are a specialist community mental health clinician. Keycap 2 risk profile. Cooma Bankstown. Medical discharge risk. Suicide risk. Aged care placement. AOT CTO. Family crisis. Psychosis relapse. Rural access barriers. Non-adherence. Globe with Asia Australia Keycap 3 environment difference. Cooma. Rural setting. Limited services. Travel required. High autonomy. Bankstown. Metro. Specialist teams. High volume. Structured pathways. Bullseye Part 2. Likely interview questions from Cooma PD. Based on PD 004970, expect. How do you prioritize your caseload in a regional setting? Describe your experience working in a multidisciplinary team. How do you ensure culturally safe practice, particularly with Aboriginal clients? Tell us about a time you contributed to quality improvement. How do you manage competing demands in a changing environment? How do you ensure compliance with legislation and professional frameworks? Describe your discharge planning experience. How do you manage professional supervision and development? How do you support families during health crises? Why rural Cooma? Part 3. Mapping your experience to each criterion. Keycap 1 Professional Social Work Service. At Vinnie's, U. Conducted biopsychosocial assessments. Delivered crisis support. Advocated for housing stability. Coordinated referrals. Heavy checkmark demonstrates accountability and health promotion. Keycap 2 Clinical Supervision. U. Reflected on risk cases. Sought guidance in ethical dilemmas. Discussed documentation standards. Heavy checkmark shows reflective practice. Keycap 3 Quality Improvement. At CMSC. Structured mental health survey process. Improved documentation clarity. Used evidence-informed frameworks. Heavy checkmark demonstrates service contribution. Keycap 4 Cultural Competence. U. Worked with CALD migrants. Used culturally sensitive communication. Avoided assumptions. Engaged families appropriately. Heavy checkmark strong rural transferable skill. Keycap 5 Prioritization and regional caseload. At Vinnie's. Triaged crisis vs routine cases. Managed competing referrals. Structured follow-up plans. Heavy checkmark direct rural relevance. Hospital Part 4, 5 high-scoring star answers. Specifically for Cooma, rural hospital focus. Medium white star, star 1, rural caseload prioritization. Herb situation. At Vinnie's, I managed multiple consumers presenting with housing instability, mental health deterioration, and financial crisis simultaneously. Bullseye task. My responsibility was to prioritize based on clinical and organizational need, ensuring high-risk clients were addressed first. Gear hash action. Firstly, I conducted brief risk screening, identifying urgency markers such as suicide ideation, risk of homelessness, family safety concerns. Secondly, I structured follow-ups using a triage model. Immediate risk same-day action. Moderate risk scheduled review. Low-risk resource referral. I documented clearly and escalated to MDT when required. White heavy checkmark result. This ensured timely intervention, reduced escalation, organized workflow. This approach translates directly to a rural hospital setting where autonomy and prioritization are critical. Medium White Star, Star 2, multidisciplinary collaboration. Herb situation. A client with bipolar disorder presented with relapse risk and financial instability. Bullseye task. To coordinate psychosocial support within a multidisciplinary framework. Gear hash action. I collaborated with GP, Community Mental Health Team, Housing Providers. I shared structured assessment findings and ensured shared care planning. White heavy checkmark result. The consumer stabilized housing and re-engaged in treatment. This demonstrates ability to function within rural NDT environments. Medium White Star, Star 3, discharge planning, hospital relevant. Herb situation. A client was at risk of eviction following hospitalization due to depression. Bullseye task. To ensure safe discharge and continuity of care. Gear hash action. I completed psychosocial discharge assessment. Housing liaison. Centrelink coordination. GP follow-up planning. Ensuring continuity of care and clear documentation. White heavy checkmark result. Crisis was prevented and relapse risk reduced. Medium White Star, Star 4, cultural safety. Herb situation. At CMRC, I supported newly arrived migrants experiencing distress and stigma. Bullseye task. To provide culturally safe intervention. Gear hash action. I explored cultural context. Engaged family appropriately. Used strengths-based language. Avoided assumptions. White heavy checkmark result. Improved engagement and trust. This is transferable to Aboriginal health contexts in rural NSW. Medium White Star, Star 5, working in changing environments. Herb situation. During peak demand at Vinnie's, service pressures increased. Bullseye task. To maintain quality care in a changing environment. Gear hash action. I maintained structured assessments. Documented objectively. Sought supervision. Adapted to service changes. White heavy checkmark result. Delivered consistent care despite resource pressures. This aligns with Cooma's constant change challenge. Why you fit Cooma specifically. You demonstrate generalist capability, strong prioritization, MDT collaboration, discharge planning experience, cultural sensitivity, professional accountability. Ali, this is now a complete rural hospital preparation pack. Next step. Fire, do you want a full 20-minute mock Cooma interview simulation? Fire, or a one-page rapid memory sheet for interview day?